Hi guys, welcome back to my channel. I hope you all are doing fine. So I have a very special guest today with me, my batchmate, Dr. Roshan. He has completed his DNB surgery exam at the very first go in both theory and practical. And I'm very happy to have him here to share his experience of the whole DNB program and also his preparation for the theory and practical exam and how to go about it. So thank you, Roshan, for joining us.
Thank you for having me.
So please tell our viewers something about yourself and also about the DNB program that you went through. How was the DNB experience overall?
Okay. Hi guys, I'm Dr. Roshan Nunes. I'm from Mumbai, Maharashtra. I did my MBBS from Swami Ramanand Tirth Rural Medical College in Ambazogai, Maharashtra. I got selected for DNB General Surgery here at Apollo Hospitals, Guwahati. The Neet PG exam of 2022. This was my first time coming here. Actually, I've heard about Assam before, but after coming here, so being here, seeing new place, new cultures, variety of people here, the climate, the humility of the people, it's a very different experience for me as well, and I liked it being here. The last 3.5 years in Assam, Guwahati, have not been anything less as compared to being at home in Mumbai. So apart from that, getting into general surgery was my only thing. And
Okay.
Since I wanted to do general surgery from the first, so I always thought, be it DNB or be it MS, be it any state, any corner of the country, I was already mentally prepared to go. So fortunately, I got selected. I got to go through the 3 years of residency of my dream branch, and it was a very good decision for me.
Okay.
This place, my department, my mentors, my HOD, and also the other consultants of all the departments at my hospital, they are very familiar, they are very helpful, you can say, and they have helped in different ways, be it during wards, be it during OPD sessions, or be it in OT. So experience wise, it was a very good thing for me. I would say the best thing that
Okay.
has happened to me by doing general surgery here.
It's great to know. And Roshan, the purpose of this video is to have you here to share your experience of the preparation of the exam, the theory and practical as well. So let me ask you first about the theory exams. So when you joined here, so when did you start your theory preparation first thing, and also how did you went about it? What were the resources you used and everything? So would you like to say something about that?
Yeah. Basically, preparation for any exam starts from the very first day of the course. So the learning, the things that you learn from day one till the day before the exam, all matters. These are all the things that are usually asked in the exams. Apart from that, regular duties, ward duties, whatever you learn during rounds, plus during OPD sessions, plus whatever you see in OT, what your consultants are doing. My consultants usually they ask, our academic is good in our department. They ask plenty of questions. They are very academic, be it in wards, be it in OPDs or OTs or anywhere, be it in cafeteria.
Okay.
So they are always up with questions anytime. And basically, these are the basic questions. Even the people who set the question papers, they want you to know the basic things.
Yeah.
They don't want you to know super specialty surgeries on the go while giving a theory exam for your general surgery specialty. So the basic things that you learn during these 3 years are actually what matters.
Okay.
Of course, apart from the clinical experience, you do have to read textbooks. For the beginning, Bailey and Love, the recent edition, that is 20th edition, is the prime book for you to complete your residency. Without reading it, without learning the concepts given in it, word by word, line by line, you can't get through the residency in general surgery. And apart from that, you have to refer to few other specialty books such as Schwartz, there's Sabistons, there's Main-Gods, there's Ferguson's. These texts actually help you focus more on the surgical aspects. Okay. When you go to the OT, you have to know your theory, okay, but also you have to know the anatomy, the surgical steps, the expected complications. These are all things that are mentioned more brief in these different texts, so you have to refer them from now and then. But you have to keep your main focus on Bailey and Love, Sabiston, and Shorts. Shorts, of course, you can't read the whole book. It's a very vast book. Mainly for, say, thyroid or breast, you can focus, mainly read from that. Sabiston is also a very big book. If you can read Sabiston and Bailey in Love, it's a very good thing. But revising Sabiston at the last moment is a very huge task. So better to focus on a few topics such as GIT. Maybe it helps a lot reading from Sabiston, and rest of all the topics are very nicely covered in Bailey. So that would suffice. For me, I would say I have read Bailey and Sabiston for a few things, shorts of course, and main goals and focus on for a few topics here and there, not the whole text. But for the revision part, during the final exam dates, we will come on to that about the question papers, how many days and all. But during that period, you have so much of a little time.
Yes.
To revise these many books is
Difficult.
not possible.
Definitely.
So better to focus on Bailey. You read all these books, you get your points, you note it down, and you keep them for revision later. So that is that for the books part.
So how did you started your study? Like you used to study any random topics from the book, like you had in your mind, or where you used to see a case, suppose cholecystectomy, or suppose any short case in the bedside, and then you used to go back and study in that way. How you used to approach?
Reading random topics initially is it's easier to be said than done.
Yeah.
Of course, in the first year of residency, you barely get time to sit, eat, or
definitely.
sleep. So reading is not a part. But in my residency, during my first year, our consultants used to ask us questions, of course, on a daily basis, on an hourly basis, wherever they see us, be it any consultant. They always asked us random questions. And if we were not able to answer, they used to give us time. So we had to read them. So in this way, in bits and pieces, we read. And apart from that, I started actually reading from my second year. Because first year, you don't get much time. I started from the general part, of course. I started from general and I slowly started reading whenever I got time. And during the last 2 or 3 months before my theory exams, I got fully into studying. I was fortunate enough that I got at least 2 to 3 months off from my duties for my study leave. That helped me a lot. Because you have to study. Even if you don't, in few places you won't get much off. But you can't blame that. You have to make it. You have to make time for studying. You have to learn. You have come here to learn. So you will keep on learning. Along with it, you have to study for yourself. Because being a surgeon, first you have to pass the exam. True. If you don't pass the exam, you won't be a surgeon. So, apart from the clinical skills, the surgical skills, that though is a different part, but you have to study. You have to read text, give it in more time. You have to indulge in it. You have to discuss among your colleagues if possible. So these things do help. Not just sitting blindly, opening the text and reading. These things
that's quite boring.
You have to be actively involved.
There should be some trigger to study a topic. That when you see and you study, it becomes.
Otherwise, it won't be retained for a long time.
It gets better imbibed in your mind. Otherwise, it's very boring to go and read a topic. Like when, as you said, you started your serious preparation almost around second year, and like last 3-4 months when you got to study more. So, were you preparing any notes? If you were preparing, and I wanted to ask, like, did you follow any previous year question pattern, like whether to take out the important chapters which are more important?
Of course. There are previous year questions given in the NB site. Usually, I took out the questions from 2017. So I went for last
almost
7 to 8 years maybe. That is enough. It's impossible to read each and every question, but keeping these questions in front of you when you are revising, during your first few readings, it is impossible to read question wise. That won't help. You just give it a normal read. When you are about to start your revision, you just mention on the topics where the questions are asked from, so that when you are about to revise that part, you get to revise in more depth. Keeping in mind that this question was asked from this topic these many times in the past few years. So there is a chance. And for DNB general surgery, I would say, not all, but most of the questions are repeated. Most of the questions, at least not the exact question, but the topics. The topics which have been asked in the previous 10 to 7 to 8 years. So if you're familiar with a topic, say you're reading a chapter, you come to a topic, and you know that previously few questions have been asked. So you read that topic in such a way that if at all asked in your exams, you would be able to write a note at least for 5 marks or 10 marks, be it anything. So you read it in that way. So these are the way that you can extract the questions. You can't read question and answer. If that was what I did, it's on to you. How you prepare. If you're a guy or a girl who is used to reading question answer type,
Hmm.
then you can, of course,
Okay.
you start it doing from your second year.
Okay.
Because it takes time. There are like lots and lots of questions.
Yeah.
If you go back to last 8 to 10 years, you get those questions, you make a note, write down the answers. That is also good practice.
Okay.
Whichever way you find it better, so
Okay.
you do that.
For our medicine, we have a pattern of writing an answer. Like when we write in the exam, introduction, clinical features, etiology, then investigation, so on. So like for surgery, definitely there's also a pattern, because when you write an answer beautifully, it gives the examiner also a chance to give you marks, and it saves your time also. So was there any pattern you would like to suggest? Any pattern of writing the theory answer?
During our university days, we used to write a whole list of
Yeah,
summaries.
yeah.
We just have the fill the paper.
Yeah,
Na,
fill the
if
paper,
it is a question for 5 marks, you write 4 to 5 pages.
Yes, yes.
If it is a question for 10 marks, you write for 8 to 10
Yeah,
pages.
yeah.
In DNB, it is not like
Nah,
that.
it's not
In DNB, you get a booklet
Hmm.
which has 5 sides.
Hmm.
Each side is marked for the question that has to be answered to in
Yeah.
that particular pages
particular
only.
page, yeah.
So, say for question 1, you have 5 sides.
Hmm.
So, you have to write the whole answer in that
Yeah.
5 pages only. You can't go to the page which is marked for question 2 expecting to get marks. If you do that, you won't be getting any marks. So, you have to structure your answers in such a way that you cover all the points. If at all there are any diagrams, you make it a habit of drawing a diagram or a flow chart, be it anything. The examiner should know, you know the concept. He won't be reading. Of course, they read,
Yeah.
but keeping it precise,
Yeah.
point wise, keywords are those that matter, because these papers are set in a way that the people who check these exams, they expect of certain keywords which, if mentioned, they know that you're familiar with the concept and you will be granted marks. So that is the thing. You can't write the whole story
Yeah.
there. You have
Can
to
you
keep
just
it
give an
simple.
example of any topic, suppose CA breast or CA or thyroid? Like if a question is thrown to you, like how will you write?
Suppose during my theory, I got a question on thyroids
Okay.
for 5 marks.
Okay.
So I didn't write much.
Okay.
Okay. I just mentioned the classification
Yeah.
in a table format.
Okay.
Bas, that's it.
So yeah.
I didn't go for writing the whole 5
Yeah,
pages.
yeah.
Doesn't make sense.
Doesn't make sense. Yeah. That's
Because
what I want to know.
being precise is what matters in DNB. You don't have to write about the
The entire thing,
background of the
yeah,
thyroids.
yeah,
You just mention
The important salient points. Okay.
yeah, important points you have to mention. And if at all, if there are any diagrams, any anatomical, be it suppose they ask any classification,
Okay.
if there is any anatomical classification, so you have to mention the diagrams as well. It helps.
So you mean to say that just give a small intro, then write the salient points, like any feature is there or not, and any important investigation is there or not, and then write the main plan of the surgery which we are going
Just
to
be
do.
to the
Yeah,
point.
be to the
Whatever is
point.
asked.
Yeah.
Because
And-
in DNB, it
yeah.
is like very precise questions.
Yeah.
They will ask, what is this? For 2 marks, you have to write about that. You don't have to mention everything for 5 marks.
Okay.
Even for 5 marks, you don't have to write all the 10 pages.
Yeah, yeah.
It's not there.
Definitely.
You don't get 10 pages in DNB. You just have 5 pages.
Okay.
For 5 marks, you have to structure in 2.5, less than 2 pages,
Yeah.
because
Another
single
5 marks
question,
is there, yeah.
another 5 marks is there. So
Yeah.
you have to balance it
Balance it.
accordingly.
So, like we have 4 papers. So, is there any specific pattern of distribution, paper 1, 2, 3, and 4 in surgery?
There is nothing as such outlined,
Okay.
but I've seen one thing, reading the questions for the last 8 to 10 years.
Okay.
I found a pattern that most of the questions, almost 90% questions, were asked part wise.
Okay.
Say, suppose it was like from chapter 1 till trauma.
Okay.
Okay. The chapters which are included in that,
Okay.
only questions from those were asked. Of course, if you are going into trauma, if there is any GI trauma,
Okay.
be it any other system related trauma, so you might get a question from that system as well in the paper 1.
Okay.
But most of them are concise to that part only. Say for paper 2, you will have ortho, head and neck, plastic. So most of the questions will be from me. Yeah, we do get questions from ortho. Usually it is like 3 questions or 2 questions in paper 2. For me, I got 3 questions. Can't help.
Okay.
It is in the syllabus.
Yeah.
It is in the syllabus.
Yeah.
If you can read it, it's good. If you can't, don't sweat about it.
So, you prepared
you
ortho
should-
from the general surgery book only or separately?
No.
not separate.
Every,
That one,
no need to read
Ah,
any separate book,
okay.
because Bailey has covered it in
almost.
great detail.
Great detail.
It is impossible to read
Okay,
the
yeah,
ortho
yeah,
part
that's
from the Bailey as well. I mean, I didn't read the whole ortho part,
that's
of course,
what-
but
Yeah,
hota hai.
will
You
do.
have to
That,
know. If it is given in the book,
Yeah,
you have to
that
know.
will cover it.
And it will be asked. It is asked. And for paper 3, you say it will start from the cardiothoracic, the vascular, and mainly the GIT portion.
Okay.
So most of the questions will be from GIT, CTVS, and OSCE. So you have to be focused more on that. But that doesn't mean that when you're going for the paper third, you won't get any question from part one or part two papers. You might get
some mix
because there is no fixed outline of question paper.
Definitely.
And for paper 4, you might say you will be focused more on the urology part, the recent advances part, the transplant part.
Recent advances, was there any textbook or the...
Yeah, of course. There are. You should at least, for me, I would say I read Roshan Lal. Last 4 years, which was from 15, 16, 17, and 18. So those are more than enough. But if you get a chance to read, you should go for the MAMC updates also. At least one update. It is a vast thing to read.
Where can one find that MAMC update?
It is available. It's available. It's available online. It's not available. Roshan Lal also it is available. But you should be familiar with the concept because they will be asked. And it's not like you will be asked recent advances only in paper 4. They might ask in the previous paper. If a topic is related to that thing, they will ask. But it will be more concise. They will be fixed on what they want to know. You don't have to write everything.
Got it. So, having discussed about the how one should write a theory answer and what is the expected paper distribution, just can you lay out certain very important topics which one must not miss at all? Like any 10 or 15 topics, like we'll definitely provide the PDF if possible. But any 10 topics or 5 topics you would like to say that one should not miss at all.
You will get questions from any corner of Bayesian law. I got a question for 10 marks. It was on neuroendocrine physiology. It was given in the initial first 2 pages. Usually when you start reading book, you miss out the introductory pages. But a question for 10 marks was asked during my time. So you will be asked question from any part of the book. That is why it is said that you must know Bayesian law thoroughly to pass the exams, because there is no fixed portion. But according to the paper distribution, questions will be more focused. But for that part, any question might come from anywhere. So you must be familiar with all the questions, all the topics that are discussed in Bailey, mainly in Bailey. If at all you can get into Sabiston and shorts, that is a different thing. But at least be prepared with Bailey.
So also about the time management, Roshan. We know that paper is for 180 minutes and there are 10 questions. So roughly 18 minutes for each question. And that's a very big task because the timer is ticking there and we
can't assign a particular question.
How to tackle the time management part and how...
That is also one important aspect. Mainly you just go through the question paper first. You sort out the questions that are very straightforward. Say you get a question for recent advances in ERCP for 5 marks. I suppose I know the answer. And it is fast for me, so I will get these types of questions which are more straightforward. First, written first. I will get these straightforward questions written first. Then I will sort out for the questions which would take me some time to think and write, maybe make up an answer. These type of questions I'll keep for the last. And I'll separate out the questions that I have no idea. Suppose it might happen. If there is one question you have no idea about it, you keep it. Don't just get stuck on it. You first complete the questions that you are 100% sure of, that you know in what structure you are going to write. You just have to keep writing. You can't stop and think. There's no time for that. There's no time for that. And you can't get into a topic, because this helps when, if suppose there's a question for 10 marks and you are well thorough in it, and you're like, I'll write everything. So you start writing. You will take maybe half hour for that question. Then you are stuck up with 9 other questions. With half hour less.
So you have to control our emotions.
You have to control, stick to the points. And for that, what helped me actually, I didn't get into those big questions first. I was into the smaller questions which are straightforward, 5 marks, 3 marks, 2 marks. I completed them first. I got rid of them. Then I have much more time in my hand. Then I would come to the questions that I know. I would answer in a better way. I completed them. Then I went on to the types of questions which were like, difficult. I'll have to make up something. Make up something. If it is a clinical scenario, I have to make up something. It is a trauma, I'll have to write all the protocols. So these things take time. So you have to do it after. If you're stuck into this loophole, then you will consume more amount writing those answers to perfection, out of which you won't be granted 10 for 10 in any Getting a 5 or 6 out of 10 is always a very good chance.
Rather than
so
just
if you're focused for 6 marks and you're leaving out 4 questions at the end of the exam, it's just not a good chance. So you have to time. You have to time out your answers. And of course, writing questions, you make it a habit. At least write few questions and answers.
got
You take, and we do have FAT exams.
Definitely, yeah.
Give these FAT exams genuinely. FAT 3,
Yeah.
these exams that NB conduct, they give you a fair idea about how the papers are there, what's the time you get to write each question, how is the format of the paper. So these things do help, but writing few questions on in your spare time, it also helps.
So in summary, the thing is ki go for the question which you have prepared well first, then try to attempt the questions which might need a little bit of thinking, and also the question which you have no idea also you have to at least give a shot, not leaving a,
Don't
leaving a
leave a
question.
question.
Yeah,
At
at
least
least
try
try to
something.
attempt. Okay.
At least
So
you
that-
will get some
okay,
marks at all.
okay. So I think that was very nicely summarized by you, Roshan, about the entire theory preparation. I think the students will definitely benefit from that. And now coming to the most important part, which is the practical, because like most of us pass the theory, but the practical is like so much hyped about, and we are so much into stress. So we get almost 2 to 3 months after theory for the practical. So how was the preparation for the practical about? And can you just say us about the distribution of the exam, how it is?
Okay. Practical wise, yeah, of course, you do get 2 to 3 months, but yeah, people who study. For me, it was like I had time to study, but like just came from a rigorous preparation for theory,
Yeah.
and plus the 4 papers, of course.
Ah.
There are 4 papers on consecutive 4 days, so you barely get any time to sleep, eat, and prepare.
Definitely.
So
Very hectic.
after coming out of that, I didn't start studying straight away. It took me at least 1 month off, then I gradually started. Plus, one more thing, academic wise, when you present cases in your interdepartmental academics, that you should do.
Okay.
During the 3 years, if you're presenting more and more, you will be well versed with the type of questions that are asked, because your consultants, they are also the examiners.
Yeah.
Okay, so they know what all questions are asked in the exam. So when they ask you a particular question, you should be like, okay,
Prepared.
these types of questions will be asked in my final exam also, so why not I prepare.
Yeah.
During my residency, when I'm giving a case presentation, I prepared well. So whenever I got a question, of course I couldn't answer all the questions. I got a lot of scolding for that as well,
But you went back and
But-
prepared. Yeah.
went back and prepared, discussed. So these are the things that when you do for 3 years, these help you recap the summary when you actually start preparing for the practicals. Because practical dates are like, for me, my theory result came at around 29-30 December.
Okay.
Then I was like relieved, chalo, finally
Yeah,
pass.
passed.
Then now I can start thinking
Yeah.
about practical.
Yeah.
Then after 9 days, I got a
Yeah.
notice that my practical will be on 21st.
Oh.
So basically, I just got 10 days.
Okay.
I had
Yeah.
more time,
Yeah,
but
yeah,
I was
but
not
like-
into it.
Yeah. Yeah.
I was
But when
not-
the
yeah.
date comes, it starts ticking. So yeah.
it actually starts taking. So
Yeah.
those last 10 days are like, kya padega, kya nahi. But okay, that is a different thing.
Okay.
Practical wise, you should know that practical is divided into parts.
Okay.
For general surgery, it is like initially you will have an OSCE. It will be of 20 questions. It will be screened live all over the country. You will be given 20 sheets. Each question will have 4 minutes and will have 5 marks.
100
They will divide. They will divide. If they might ask 5 questions for 1 mark each,
Okay.
they might ask 1 or 2 questions for 2 mark, remaining questions for 1 mark. According, these are like straightforward questions.
Okay.
Preparing for OSCE, yeah, I did look for videos. Few highlighted ones are Dr. Professor Chindamani sir's videos.
Okay.
And sir has a very good range of videos, be
Okay.
it ward rounds, be it OSCEs, be it case preparation, case discussions. It's a very good source
Good,
to refer to. And also you have Dr. Makanla Sahasa's video. There are many videos of ward rounds, OSCEs and all. You will get more videos.
More content.
And one more thing is that there are NB classes, webinars.
Okay.
They go on routinely.
Yeah.
But it is always nice if you can attend those classes live, because these are the things that help you in your theory as well as in your practicals. If there is a seminar, any theory or discussion, it will help you. Mostly it is for the case presentations.
Okay.
At least try to attend, not all, but most of them.
And yeah, they have classes like they send the
A few
links
of
for
them
the
are recorded, upload. You can refer back to them. You can go to the NB site and refer back to them. But not all classes are.
Yeah.
But yeah, do attend these classes. These classes actually give you the fair amount of idea that
how the question will
what
be
type
asked.
of questions, because your consultants will ask you a particular type of questions.
Yeah.
But the
And we
consultants who are going to be there for your exams, they might have a different set of questions. So the more consultants or more case discussions that you attend, give, or you listen to, the more variety of questions you come along with. And these are questions you will get familiar with.
Okay.
You won't be shocked if
Yeah.
you are asked any question from it in your final practical exam.
Okay, got it.
And most important thing is whatever you have learned, whatever you have seen during these 3 years,
Okay.
be it in wards, be it in OPD, be it in OT, these are the things that will be asked in OSCE.
Okay.
These are like straightforward questions. They will give you an instrument, they will ask you the name.
Okay.
Bas.
Okay. Very simple.
Or they will give you an instrument, they will ask where it is used.
Okay.
Bas. It's not like rocket science. You
Okay.
have to be there in the residency to know.
Okay.
So in a different preparation for OSCE, if you have worked hard, if you have been sincere to your work during the 3 years, then you might not read any other data for OSCE part, because it will be that
It's quite
simple. If you are known to those things,
Yeah.
it will be day-to-day things.
Okay.
Apart from that, there will be 2 long cases. So OSCE will be for 100 marks.
Okay.
2 long cases, 50 marks each.
Okay.
So that will be the next 100 marks, for which I got barely 40 minutes for 2 cases. I got
Okay.
2 cases. I had to take the history. I had to do the examination. I had to write it everything.
Okay.
Everything done 20 minutes per case.
Okay.
So you have to speed it up. You can't just sit there taking history for hours. You don't have hours.
Yeah,
you just have 20 minutes to get it done
Okay.
in a single shot. If you're not done it, it will be a bad impression.
Okay. Okay.
If you're stuck on the history only, if you're not done the examination at the end of 20 minutes, when the examiner comes, you will see the paper, your paper is blank, your examination is not done, you're just stuck at history.
Yeah.
Definitely.
Definitely. That creates a bad impression. Yeah.
That creates a bad impression.
So, what was your case? Long case? Two long cases? You got?
I got one was ventral hernia and one was a malignant parotid tumor.
Okay.
One more thing, these practicals are not in the same state.
That is one.
That
big
is another
challenge.
thing. That is a very big challenge.
Yeah.
Going from Assam, my practicals were in Kolkata.
Definitely.
Although knowing Assamese helps a bit to understand Bengali, but still,
Yeah.
it's a completely
It's a
different
different
language.
stress
It's
to go out in a different center where you know known people.
No
and
known people,
totally,
the language is different, but you do get interpreters. They give you interpreters.
Okay.
But for my second case, the interpreter, she could not interpret rightly. So for my malignant parotid case, I had to make up the history.
Okay.
I have no time. I have just
yeah.
20 minutes. The patient is not cooperating, not letting me examine.
Yeah.
Is not giving. He's changing his history 5 times in 5 minutes.
Okay.
So I had to come up with something. You
have to use your common sense.
You
also.
have to.
Yeah.
So accordingly, I made a history, and I presented it. My examiners liked it. Okay. That helped me.
Okay.
And one more thing, you have to tailor your answers to what the examiner is expecting of you.
Definitely.
For example, during my ventral hernia case, I was like, the professor was more into laparoscopic, minimally invasive surgery. So, if I would have said that I would go for an open surgery, I didn't say that I would do, but it might be done.
Definitely.
You have to use your wordings right.
You can't commit to a certain thing to
that you are not capable of doing by yourself. You have to say, sir, this can be done.
Yeah. You should be open to answers.
You should be open. And I tailored my answers more toward the minimally invasive, because I got a gist that the examiner wanted me to answer minimally invasive only. So I was into that only. So he was very impressed. The long cases helped me get more marks in the following ward rounds and tables, because the
impression was set right.
Impression was for both the cases. So that helps.
Okay. Just before moving forward, I would like to ask you to mention the long cases, like this you should prepare and go. Is there any list of cases?
No. It depends.
Okay.
It depends on the hospital. It depends on the locality. It depends on the availability of patients.
Okay.
It's not like dummy cases are given there.
Yeah.
There are actual patients there.
Okay.
So you can't predict.
Okay.
There was a case of squamous cell carcinoma of Neet.
Oh.
These are not common cases, but it was there.
Yeah.
So which case will be given to you? It's a lottery system. Na?
Okay.
So you have to be well prepared in everything. You can't be like, there will be hernias, there will be gallbladder CAs, and
these are common cases. Will be there.
Thyroid, there will be everything. All the cases given in the book will be there. It depends on the region you are. So at least be versed in all the scenarios. Get the theory. Of course, you have to have
the examination
methods
and
your examination methods. Whenever they ask about your particular examination, don't just stand there and answer them. When you are asked, how will you palpate, or suppose how will you do this examination, you straight away start doing it. You just don't stand there and tell you, sir,
demonstrate.
Don't do that. You just start demonstrating so that the examiner will know that you know the things. So he won't get into that much. And of course, they will be asking theory in practice. So don't get the idea that theory won't be asked in practice. It will be asked, but in a particular way. So you have to tailor your answers
Yes, yes.
according to what the examiner is expecting of you. After all, any examiner, for
Yeah.
that matter, is not there to fail you.
Definitely.
No examiner is there to fail you.
Yeah.
They just want that, okay, I am passing this guy, at least he won't kill anyone after going there.
Yeah, that's the main basic.
They just want you
Yeah.
to know that at least you are a safe surgeon. For general surgery resident, the examiner expects that if I'm passing this guy, he should be a safe surgeon. So that is what they assess.
Definitely.
You don't have to go there and tell them that I will do these all advanced procedures. They don't want that.
Yeah, they don't want that.
It
They
is
want
not
your basics
expected
to
of
be
you.
right. Yeah.
They want your basics to be done right. So get onto the basics. Be safe, be conservative, don't be too aggressive in your answers, and be respectful. Most important, be respectful. If you offend the examiner,
Yeah.
these
That
things do matter.
Do matter, definitely. So for books, for the long cases, like any books or like videos you want to suggest?
For general surgery resident, reading as thus is the utmost,
Gold standard, yeah.
gold standard. I wouldn't say gold standard, but it is the more preferred. It is a very good book.
Okay.
All the examiners, I would say, they are very well versed in that. If you answer from that book, if you quote the answers from that book, you will get positive points. I won't say that you should not read other books, but if you say a particular answer and you say, sir, they will obviously ask, where did you read it? If you say, sir, it is given in as thus, and if you're sure about it, then that's a plus point. Because knowing as thus is the only thing that will help you pass the examinations.
Okay.
Apart from that, I read Makanlal.
Okay.
It did help a lot. And from YouTube,
channel, any channel you want to mention, like if you remember?
No particular channels.
Yeah, you
but
just
I
searched the
did,
topic and-
I just searched. I found Dr. Makanlal Shah's videos, Dr. Professor Chintamani Sir's videos.
Okay.
They help.
They help.
The case discussions and all,
Yeah.
the ward rounds, ward scenarios. They will be a particular patient. They will try to get questions from you.
Okay.
In a ward round, you are not supposed to answer it rightly. They will give you a page.
What this ward round is exactly, like people might get confused. So ward rounds and the table. So we'll first discuss about the ward round. So what is this ward round?
Ward rounds is just like anything that you go in your routine day-to-day wards.
Okay.
If you go for morning rounds or evening rounds, you go a patient, you know the history. Now you have to decide what next to do for the patient. If there is any complication, if the patient requires anything, be it
next decision.
upping the medicines, being upping the fluids, being stopping any medicines, being the oral diet, oral feeds, and also these are all things that you have to anticipate, decide. Then only the patient will get. So this is what they want from you. So in ward rounds, they will be given one patient.
Okay.
There will be a paper with a history.
Okay.
Suppose a post-op patient is there. For me, one case was like one patient was she had a open CBD exploration. She was on T-tube.
Okay.
This was the same examiner who was more into minimally invasive.
Yeah.
But this patient underwent open surgery. So it was like he asked me, what do you want to know? He didn't ask me questions right away.
Okay.
He said, this is the patient, this is the scenario. What do you want to know?
Okay.
So I was like, sir, when was this done?
Okay.
Why was it done in open way? Why was it? Because I knew he was more into minimally invasive. So I was like, sir, what was the reason for converting this surgery into open surgery?
Yeah.
Was there any particular reason? He said no. Then he wanted me to ask about the diameter of the CBD, particularly in this case. So, but he didn't ask me that. He was like, what more do you want to know?
Okay.
And I went, sir, what was the diameter of the CBD? He said, let's say it is 13 mm.
Okay.
So then say, sir, instead of getting a T-tube drainage, I would close primarily, put a stent and come. Yeah. He liked the answer.
So that
he wanted,
instead of giving a lead question, he was trying to get the questions
out of you
and make you think.
And
Okay, got it.
And then again, you have to tailor your answers according to that.
Got it.
Then again, he was into it. Will you do it open? Will you do it?
Got it.
Minimally. So if it is
ward rounds are like mainly kind of short case only, like where they give you a scenario and they give you the thing and they ask you questions from
what do you want to know next. They won't ask you directly. They will get out the questions from you.
So such scenarios are 4.
There will be 4 different ward rounds, 4 different post-op. In general surgery, you will get a post-op. Be it anything. Okay. There will be something there. They will ask you what you will do next. So you have to answer accordingly.
Now coming to the table vivas. So there are 4 tables, I think.
Yeah, 4 tables.
So what are the expected things in the table? Like in your scenario, what was it?
In my scenario, it was like one table was for specimens, of course. There will be specimens, post-op specimens. So first of all, you have to see. You have to say which organ is it. Then you have to say preserved in water.
Yeah.
Right? You have to
that's the basic
that's
standard.
Basic standards. and then you have to guess ki what is the disease, what type of surgery was done in that patient,
Okay.
what is the specimen. You have to answer these questions. Then they will go on to the theory part of those. Suppose they'll ask a classification, they'll ask a TNMC, they'll ask anything.
Yeah.
What are the surgical steps? What are the complications? I will know on that. But first you have to identify these things. Then there will be a table on imaging.
Okay.
There will be X-rays.
CTs.
There will be CTs. There will be MRIs.
Okay.
In your case, there will be ECGs.
Yeah. Like we had.
Luckily, it was not there for me. Somehow,
For surgery people, ECGs.
it's not like that.
Not a
You
big
should
deal.
know.
You
You should know.
Generally, you give a medicine opinion for that.
You should know,
If
but
it is
yeah.
there. But anyway.
You might get.
Yeah.
You
might
can't say no.
because
Ki, yeah, why
I
is
still
ECG
remember-
kept in a surgery?
Yeah, I still remember you people got a hyperkalemia question in your theory.
That
So
was in theory.
so like
Can't
if you
say.
can get a medicine question in theory, so you can be asked anything regarding your
Anything.
medicine in
Yeah, so it
practical.
was
also.
just general practice exam.
Definitely. Yeah,
No,
so
that was
specimen
one
is
thing.
done. One is your CTs and the imagings.
Imaging is
then-
done, and one was for the instruments.
Okay.
Any instrument,
Any
any
instrument,
surgical, any instrument.
So
So they'll ask. These are all given in the books or routine exams. These are not some hi-fi instruments that you'll be asked.
Okay.
If you don't know the basic, if you don't know what a Foley's catheter does, what are the non-urological uses? If you don't know that basic, then you'll
yeah,
flop.
that's difficult. Yeah. Difficult.
These are the basic things.
So any table for the procedures or the emergencies or the recent trends like that?
For me, the fourth table was my thesis.
Okay,
part.
thesis
It
also.
was for my thesis.
Okay.
But you might get, depends on the center.
Depends on the center to
A
center.
few of the centers they asked procedures, surgical procedures. Few of the centers didn't have this thesis. Few of them were on logbook and all.
Definitely.
But you do have to carry your logbook and thesis, but you don't have to submit. Please carry it.
Uh-huh.
They will ask you definitely. Have you brought it? If you say no, that will again lead a bad exam.
So I think that is really nice. We have summarized your entire preparation, your experience about the practical, right from the OSCEs, long case, and the ward rounds, and the the tables. And I think that will help the students definitely.
More than enough.
Yeah, I
This is
think
more than
that,
enough.
yeah,
These are basic things.
So I really want to thank you so much, Roshan, for coming to my channel and sharing your experience, because I think there are very less content on YouTube as well for the DNB surgery preparation. And also like since DNB, there's a myth also maybe that DNB surgery is very difficult to pass because of the past experiences of the practical percentage, like the people are not. But I think this is changing with the coming
It
years.
depends on
Yeah,
you.
it depends on
Any
you.
exam, if you have
Yeah.
to pass, you have to
So,
study.
yeah,
If
so
you
if you
don't
prepare,
study,
if you prepare strategically, I think that will make you
it will be easier
go
for
through.
you to pass.
And I would like to congratulate you also for passing the exam at one go. And lastly, I just want to end it with: do you have plans for Neet SS or
Yeah, of course.
MCH?
Yeah, of course.
Okay.
Yeah, I am preparing for that. How it goes.
So I wish you all the best for the future, and thank you
you.
once again for joining me.
Thank you. It's my
Cheers.
pleasure. Yeah.